All right. Well, we are in our third reading of Boychuk's National Health Insurance.
Week 4.
That's right. In the final stretch, only one more section of reading. I think we're moving into the concluding chapters next week. Here in Massachusetts, we have a heat wave. It's in the high 80s, so of course we're talking about Canada now. And the Canadian history of health reform is very different from the one we just got from Boychuk looking at the U.S. Canada got to a national single-payer healthcare system, more or less, but it went through a very, very winding road. And if you read it, you see exactly how winding it is and how much there was a battle at each step. So provinces started passing universal hospital coverage in the 40s, starting with Saskatchewan, but there's a few other provinces after that. There's a national hospital care bill passed in the 50s. And then provinces, one province actually passed physician coverage in the early 60s, and then there was national physician coverage in the mid 60s. And then not until the 80s was the Canada Health Act passed, which sort of consolidated everything together. And then even today, there's sort of an ongoing fight to get universal coverage of prescription drugs, which varies province to province, universal coverage of home care, and some other things that are sort of left out of the current Canadian healthcare system. So even digging into all those phases is a daunting task. So I think we're not going to go over in depth all the little steps and fights in history. We're going to talk about sort of the big themes that ran throughout and what they mean for us as health reform activists. So one of the things I think stuck out to both of us was Boychuk's take on the role that private insurance had in Canada in either helping or hindering reform.
Right.
You want to
Sure.
jump on this one?
I think that, at least for me, I felt that the expansion of private insurance always means that it's going to be harder to pass a public plan because more people just get used to the idea of being on private insurance and they like what they have and they don't want to be switched over. But actually, Boychuk makes the argument that this existing infrastructure of private insurance made it easier, actually, to go into public insurance. One, because there was sort of this ready-made revenue source that would just be easily transferred from private to public, which going back to... Oh, sorry.
No, go ahead.
Oh, okay. Which going back to his earlier chapters where he argued that early reform efforts failed because some provinces, or maybe if one province started collecting revenue for health services that weren't already being paid for, it would put other provinces at a disadvantage trade-wise or in some other way. And I actually thought that was fairly convincing.
Yeah, and this is a very common explanation for why we don't have health reform in the US. It's that we sort of took too long, and then there was a huge private health insurance system in the post-war period, and that made it impossible for us to sort of win it here because so many people were covered, and maybe, this is the narrative we get within the Democratic Party a lot, like you can't threaten the healthcare people have, which is nonsense. People don't like their health insurance companies. They like having they like access to care.
Yeah.
But then also you have this industry that's entrenched in that will fight everything you do. But in addition to what you said, which is that there's also ways that it helps you, he's arguing that Canada, when it at all these stages, when it passed, universal hospital and then physician coverage, there actually was very widespread private health insurance.
Yeah.
Similar on a scale to what we have here in the United States and have had in the past. So historically, he's just saying it's wrong. It's the wrong take, even though it's very common among historians.
He also makes the point that it establishes like a public acceptance of collective insurance, and the ACA is very controversial, but one thing it does is it gets us closer to establishing like the right to having health insurance or health care. Mm-hmm. And so, viewed through that lens, that's also an interesting sort of side effect of like the ACA or any expansion of private insurance is that it sort of like normalizes the idea that everyone should have health insurance.
Yeah, and I remember when health reform was passed in Massachusetts, which was sort of like the precursor to the Affordable Care Act, even like Mitt Romney was using rights language. There'd sort of been wide mainstream acceptance or co-opting of the language of the single payer movement, of rights-based language. So I think some of that has happened, and I told you about William Shao, who's a professor. He's an actuary actually. Used to work for Medicare, but he sort of coordinated Taiwan's transition to a single payer system, and he has like the best job in the world. He helps countries do like healthcare reforms, massive like giant healthcare reforms. When he was talking to folks in Massachusetts, he said the fact that so many people are covered, even if their coverage is not always good, really means that you're already spending all the money. You don't need to spend any more money, which is very different than if you're in Taiwan and only half the population has insurance. Then it's really a big difference when you switch to universal healthcare, because you're not only changing where the money passes through from private to public, but you're also vastly expanding who has coverage and how much care they're going to get. So, anything else on this, or should we talk about a few other?
Let's move on.
Dynamics. Okay. So one sort of at the core of his argument is that provincial politics and the politics between provinces and the federal government in Canada drives a lot of the health reform. And actually, even though this is like the title of his book and it's sort of in the summary of the book, it seems that he's mostly making this argument about physician care. Mm-hmm. That when it comes to the 60s and there's a movement to make physician coverage universal across the whole country, that this is where the dynamics with Quebec really play out. And then he has kind of a different, interesting alternative explanation. He sort of downplays the early adopters, like Saskatchewan adopting hospital care, universal hospital care, universal physician care. He says that doesn't necessarily grant you a national plan. There's like a whole different set of dynamics that happens that leads that to take place. So his argument with Quebec, and I think part of the reason this is so hard for me to read was he was arguing about how there was a competition essentially between Quebec and the federal government for the allegiance of citizens, and that a fundamental part of your national identity or your provincial identity is these basic rights that get protected by your government. And it was so weird because we have so few of those in the United States. We don't have like a right to housing. We don't have right to health care. We don't have free higher education. Primary education is provided at a super ultra local level. So a lot of this is a dialogue about how health care became like part of a national identity.
Oh, right. And how only the language of rights only entered it after we had already passed, or after Canada had already passed it, and it became sort of a point of pride.
Right.
And not necessarily a driving force for the passage of universal care.
Imagine something like that. It feels like a stretch here, but in regards to Quebec in particular, this period during the 60s where national physician care was adopted was a time when there was, a nationalist cessation movement in Quebec to secede from the rest of Canada, and there was bombings, there was kidnappings, there was executions, just really intense battle over sort of the status and sovereignty of Quebec. And during this phase, the federal government started looking at social programs it could offer that would essentially make Quebec residents dependent on the federal government, dependent on or indebted to or directly having a relationship with the federal government. So this was one of those, pretty intentionally, one of those plans that was offered to try and win over Quebec. And the result was that officials in Quebec were trying to race to develop their own universal physician system on their own. And it turns out that the federal government sort of won in that tug of war. But we also we don't see that in the US where there's like, well, some states do, but many states are not racing to win the battle of providing social rights to their residents. It's almost like a race to the bottom in some states.
Yeah. What was interesting to me about Quebec was that Quebec had greater support for the passage of like a national health insurance plan, and that if you look at it, or if you look at the U.S. For sort of a similar dynamic, the South also had quite high rates of support for the idea of a national health insurance plan until it was determined that that plan would involve the integration of hospitals. And,
right.
And so that also demonstrates how strong race was in our history and how Canada was able to take a different path.
So before we move on from this sort of province and federal dynamics, I thought there was some interesting little tidbits about how Saskatchewan, which sort of led the way both first in hospital care and then later in physician care, and faced massive opposition from physicians in particular, how they actually passed it first in a part of Saskatchewan, and not even in the whole province. There was universal physician and hospital care in what was called the Swift Current Health Region. This was like a rural part of the province that was facing drought, and they couldn't keep doctors there. There was doctor shortages, and basically the whole, the private system had collapsed there and wasn't functioning. So they implemented sort of a very super regional single payer plan just out of necessity.
Yeah. No area too small for single payer.
I know, yeah. Which I think we've had little tiny episodes of that in the United States, like. The Affordable Care Act expands Medicare to like one city that's suffered from a public health crisis, or one area. And I believe after Hurricane Katrina, because people didn't have their health documents, their insurance documents, nothing, they didn't have birth certificates, there was so much flooding and displacement that for a while they basically expanded Medicaid to everyone in the New Orleans area. So we see, where the private system just completely falls apart. We sometimes see single payer move in as a model, but it never was institutionalized in the United States in the way it did, and it didn't lead to sort of broadening of the crisis. But anyway, I thought that was an interesting little history, digging more into Saskatchewan. So the last thing that let's talk about is this interesting thing about how fierce the opposition was to implementing universal hospital or physician coverage, but especially physician coverage, and then just what public opinion was like in Canada at the time they passed it.
Sure. I mean, I was really surprised to hear, from Boychuk's perspective, that opposition was actually stronger against public health insurance in Canada than it was even in the US, and that, the Liberal Party, the Chamber of Commerce, dental, pharma, doctors, and even the press was against it. And often, we as single payer activists always think that the press is against us. But the examples that he cited of editorializing by papers about the consequences of public health insurance system in Canada were much more than what I think we've seen. So yeah, I was really surprised, and a lot of these things give me hope. For the passage of if they could do it with this kind of opposition, then there's no reason.
Right. And the one thing they didn't have was segregation, of course, which adds like a layer above, just physicians opposing it. But yeah, they said that there was more money spent by the Doctors Association in Canada, in the provinces in Canada. I think they were looking at Ontario in particular. That physicians had more power because they basically controlled the entire medical system. They even owned their own insurance plans. And also, I was struck by the public opinion polls that were not super high in favor of national hospital coverage or national physician coverage until well after the plan was passed. I think we actually today have higher support for single payer in the U.S. than they did in Canada when they passed it at these different levels. So if they can do it, we can do it, right? I think the one thing that's probably different now is that the healthcare industry is much larger in the United States today than it was in both those countries back in the 60s and 70s or 40s. And it's just, there's more parts of it now. Now there's the pharmaceutical industry is quite big and powerful. The hospitals have become for-profit in those intervening years. A lot of providers have become for-profit. So I'm not sure today it would be, I think there's still a lot of power at play.
It's a lot of power, but it also strengthens our side because back then, nonprofit insurers were a softer target than for-profit insurers, and the for-profit industry has been vilified by a lot.
Yes, no one actually likes insurance companies, it turns out. And the other dynamic that we were talking about is that, throughout this whole narrative that Boychuk is talking about in Canada, for most of it, healthcare costs are not even discussed.
Mm-hmm.
It's not like healthcare costs are ruining the economy of Canada, and
Mm-hmm.
that's why they're passing hospital coverage and physician coverage. It plays in later when they're sort of tweaking the system and how the federal government pays provinces. But today, healthcare costs are so high, rising so rapidly, and they're so destructive on so many levels. And we're already paying it, so there's no. I think that really does put pressure on the need to continue to replace the system. And I think that's the reason why we've seen so many incremental reforms, because politicians know they have to do something to at least pretend that they're addressing the issue. And when they don't work, the pressure continues to mount from year to year. So that is also, unfortunately, in our favor, although it's not what I would wish for. All right, so I think we look forward to your comments in the forums, and we'll be moving on to like the final concluding sector, and then we'll spend more time talking about like what does this mean for activists in the US. All right, see you.